So I wanted to ask you about, um, yeah, about the rural context. What is it? What does healthcare look like in the country? What does elder care look like? And is it appropriate? And what does accessing appropriate healthcare look like in that world?
Those things that you can access by phone, you can access. Okay. But someone living in a rural home is at the bottom of the list for everything. If a PSW coming to your home, well, the private services can find all sorts of work, within 5-10 minutes of their last visit. They're not interested in driving an hour for someone because they don't get paid for the travel time. Things like day programs don't exist unless you're prepared to drive 45 minutes or an hour. For someone that needs to move into a residential support situation, again, there's nothing in their neighborhood. They're relocating to a larger center, which is unfamiliar to them in most cases, and totally separates them from all of their friends, their community supports. And so that becomes one of the real struggles. Like, do you stay where you really need help and count on those friends and neighbors, or do you go where you can get the help and then be absolutely alone and isolated? And for someone, individual trying to make that decision, it's hard. And the other reality in so many of the small rural communities is, they've grown up there, they've got their connections, but their children have left for work or education and are not nearby any longer. So they often don't have family to turn to. They feel guilt trying to turn to a family member, knowing that they've got to travel a long distance to be there. So, or they, she's working, I can't expect her to come. They make excuses for the individual and suffer. So, hard to access any of the programs, any of the supports that you can get in a larger center. So no, it's not adequate.
Not mobile. And I got a call from the emergency department at 12 o'clock telling me to come get her, that there was nothing really wrong with her. I'd gone and stayed with her for a while. And then it was going on too long. We didn't know when we were going to get a diagnosis. So we left for a little bit to get some rest. And then I get this call saying, come get your mother at midnight. And it's like, no, I can't do this. I live on the second floor of a house, and I have no way to bring her up there tonight. And I can't bring her home because either she's going upstairs and living upstairs on the second floor because that's where her bathroom is, or we're going to have to figure out what to do about a bathroom on the main floor, which did not exist. So they granted us the favor of leaving her there for the night, and we were able to hire an ambulance the next day, and they brought her to my home and carried her upstairs to the second floor. And she stayed with us for 2 weeks, and we were able to get a spot in rehab for a couple of weeks, and then they sent her back to us. And when I say us, I say my partner and I. And we were there 24/7 with her. We finally were able to get some kind of respite care twice a week for a couple of hours, which was good because we had to go out and get food and the necessities of life, and just getting a little break from the stress of living with her. My mother is very difficult, and so we had some moments that were quite hard, especially at the beginning when we had her. We had a spare room, we had a cot, so we put her on the cot in the spare room, and couple of nights we got woken up by her screaming because she had decided that she could get up by herself and go to the bathroom. And here were my partner and I trying, at that point, a 125-pound woman trying to lift her back into bed because she couldn't get up. So it was quite stressful. In the end, I had to kind of get mean and just say, Mom, you have to stop trying to get up. I've given you a bell. Ring it, please, because if I find you on the floor another time, I'm going to have to phone 911. So, so that helped that matter a bit. But yeah, it was stressful. A few weeks for us, definitely. So,
How long was she with you, and where did she go after the rehab?
she came back to us. Yeah, she was with us for 2 weeks, and then they were able to get her into Providence.
Right.
And she was there for rehab, but all they could keep her there for was like 14 days. And so they sent her back to us. And then it took us another couple weeks. And what was difficult is, one, my relationship with her, but two, there's a reason I didn't become a nurse. You know, I'm not that kind of person to look after sick people. Even though I had 4 children, and looked after them when they were sick. But, you know, it was not what I was wanting to do. And so we finally were able to get an interview with, what is it called, CCAC, I believe. And they sent someone over to meet with us. And she was telling it was going to be months before they could find someplace. And I said, no, you can't do this to me. I can't. I'm an only child. Okay? I have nobody else I can turn to other than my partner to help look after her. And this is not in my wheelhouse. We need to find someplace. So I think about a week or so later, they called and they had found a place nearby, which was, we were fortunate. It was very close to us, within walking distance of where we were living, because she could have ended up on the other side of the city. So we decided, we went and looked at it. It was, you know, it was not the nicest place, but it was convenient and we could get her in immediately, you know, in the private room that she wanted. So we decided to take that.
I'm curious about money. I know that you and Dee have had times of financial insecurity, and elder care can be prohibitively expensive. And yeah, I think there'll be some folks who are participating in our workshop series who might be in similar positions with, you know, who are needing to make sort of tough financial decisions. I'm curious, yeah, how does the elder care experience look like when you don't have an abundance of wealth?
That's probably why my mother ended up in the home that she did. I mean, I saw a much nicer place. She would have loved to have gone to Providence, someplace like that, in which I know she would have been happier, but we didn't have the means to do that. So thank goodness at this place, most of what she got in her pension covered her care, and the rest, I think, through $400 or $500 a month difference. Because this place even, you know, as it was, cost $2,300 a month. So she had to put in another $500 a month about. And what was I going to say?
I'm sorry?
What was I going to say with that? Yeah, I would love to have put her where she wanted to be, but that was it. That was the place that we could afford to put her. So that's what we could do. We did the best we could, you know. Unfortunately, I found out a lot of things after she passed, that was happening in that home. But I really feel bad that I wasn't aware of what was going on there.
So the other thing I wanted to ask you about, you've spoken about sort of the work of navigating the unknowns. Would you be willing to say more about that?
We didn't really have a hard time, because we had the hard time was convincing them that they needed to leave the house, and that was sort of facilitated by my mom slid out of a chair at church, ended up in the hospital on a Sunday. Our cottage got hit by lightning on Tuesday and burned to the ground. And when Mom came home, that was when the caseworker came. So the one thing I want to say is to older people, try not and wait till something happens, that a crisis happens that you have to move. Do it on your own terms.
So I'm curious to know, I know, as I understand it, your mum lived in a couple of different forms of supportive housing. Would you be able to explain what the differences are and sort of
Yes.
what is the difference between a retirement residence and long-term care, for example?
Okay. Like the most desirable place to be from, one's own perspective is independent living, which, it could be like just a seniors apartment building, but you get into places where like there are shared services, but the basic premise is that you can look after yourself. So you can get yourself down for meals, or there was a kitchenette. That may not be standard, but Mom's place had a kitchenette, and she had a living room and a bedroom, and obviously private bathroom. So there were activities that people could do. So that was that one. A retirement home is like an official terminology of the Ontario government. And, they don't pay for anything. The retirement home is privately owned. They have a nurse on staff. So that's a defining feature of a retirement home. And so they can handle your medication. The independent living, doesn't do that. But the retirement home also provides meals and housekeeping activities. Long-term care, which is commonly known by folks as nursing home, but the official term is long-term care. These are subsidized by the Ontario government. They're the ones with the huge waiting lists because they're subsidized. And but the room rate is set by the Ontario government. It's based on, you can have a private room, you can have a semi-private. I don't know if they still have wards after COVID, but there's different rates, obviously, for the level of privacy. So, we were doing our search for Mom in 2018. That was the point when she could no longer live in the independent living because she was forgetting to go for meals. She was wandering the halls at night. And, they didn't kick her out. They were actually really good with her, this place. The managers, if she didn't show up for a meal, they would go upstairs and get her. But, if they had the weekend off and it was temporary replacements, she didn't eat. So, my sister and I very quickly said, okay, we got to find someplace else. But the first thing, she had to pass an exam from the care coordinator. This is all handled by an organization called LHIN, L-H-I-N, what does that stand for? Local Health Integration Network. So they will come and do an assessment. They'll recommend what kind of care you need. So they're the conduit for both long-term care and home care, which is also government funded. And that's where you run into the major problem with long-term care, is that the wait list was like 2 years long. And she needed care today. And that's the problem everybody has. Now, if it is considered urgent, like you're in the hospital and they're trying to get you out of the hospital, they will make you go to whatever long-term care home has a vacancy, which means it's something that nobody else wants, really, because the good ones all have waiting lists. Now, in theory, you remain on the wait list for the facilities that you've chosen, which I haven't mentioned yet, so I did that backwards, sorry. When Mom was failed her independence test, we had to come up with a list of long-term care facilities that we wanted her to be on the wait list for. There was a private dementia care facility in London. Private means it's expensive, and what they quoted us in 2018 was, oops, wrong place, $6,200 a month for semi-private room level 1 care. Level 1 is the lowest level, and they had 4 levels, and it went up by $300 a month as you needed more care. So I was in charge of the money management, and so I took a look at how much she had and determined that she could last 5 years if she stayed at level 1. And we decided we wouldn't go there because after 5 years, she's from a long-lived family. So we're not going to say, sorry, Mom, you got to die in the next 2 months. So, like, that would be pretty bad. And we would not do that to our mother. So we kept looking for other places. The care coordinator recommended a retirement home because they have a nurse. It was important for them, the nurse, to handle the medication and whatever else. So we went to look at one, which Mom and Dad had actually looked at, and Mom had been fine with it. Next time we went, she had been to the independent living place. Was newly built. It was bright and sunny, and the rooms were big. The hallways were wide and well lit, and nice paintings all around. And this retirement home was a little older. The hallways were narrow and they were dark. And the rooms were smaller, and it was just a room. And we were assuming she'd be okay with it because she was okay with it a few years earlier. But we went back to the office with the manager and so, Mom, would you like to move in here? No. And Mom never said boo to anybody except her children. She had no trouble criticizing us, but she never criticized anybody else to their face. So that told us that no, we couldn't put her there. Yeah, it was kind of funny, but not. So we kind of gave up on that, continued with the home care at the independent living facility. The other places had wait lists. Well, this one had a small wait list, but we decided to redo the math on the private dementia care home and said, well, if she's on this wait list that's supposed to be 2 years long, she had enough money to last for 2 years and then, have enough to take care of her spending money, whatever, for probably the rest of her life. So we went back to them. Of course, the price had gone up, and my notes didn't say how much it was when she went there. And her bank account is no longer available for me to look at. So the price had gone up, and she needed more care. She was no longer a level 1. I don't remember what level she was. So I think we were paying somewhere $7,000, $8,000. But there was enough money, she and Dad had saved religiously, and she had his veterans pension. She had a fair bit of money, which is the best position to be in when you're looking for care. So we moved her in there, and we took her to look at it, and she quite liked it. She didn't remember that she had liked it because she was at the point where she didn't remember much of anything. The bonus for us was she did still remember who we were. We didn't have to go through that. Anyway, so we moved her into there. And then, just kind of waited for her to come up on the list. And so at some point, my sister called the care coordinator and asked how she was doing on the wait list, and it was like a panic at the other end, that they had assumed that since she was somewhere, she didn't need to be on a wait list or something. Okay. So anyway, so I don't know if they'd actually taken her off or if they just kind of pretended she wasn't there, and if anything came up, we didn't hear about it. So the next thing was, by this point, she's living in London. So we started looking at places in London, and we actually got passed on to a care coordinator in London.
I'm also curious, you've spoken a little bit about the private dementia care, but could you talk more broadly about what does it cost to access various forms of residential care?
Okay, the home care was free.
Okay.
Like, you can get private home care if you can't get the care coordinator to agree to pay, or if you don't get enough hours, but we didn't pay for that. So that was nice. I don't remember what she paid for the retirement home. It was affordable. And so was the independent living. Actually, the independent living was cheaper than the retirement home, which I don't understand, really. Yeah, they're paying for a nurse, but she's split over several dozen, like 50 people or something. Anyway, and the dementia care is, I think it was somewhere in the $7,000-8,000 range, which is why she couldn't stay there for the rest of her life. And yeah, it turned out that the rest of her life was longer than the 5 years. Yeah, it was about the 5 years, actually, I guess. But
I think that those are the questions that I wanted to ask you. Are there other things that you sort of feel a calling to speak on?
okay. When I was talking about home care, the retirement home Mom was in, they helped with a bath once a week. She was used to having 2 at home with home care. And so the home care, no problem, she can keep one of them and, arrange it for the day, the other half of the week. The other thing that was a godsend to us was Lifeline, which is a device that you can signal for emergency help. So you don't need to be able to get to a phone. And when Mom was still at home, she had this. And she continued to have it when she was in the retirement home. It's just that instead of my sister getting the call, the retirement home people got the call. So how it works, you've got a little device. It's got a button. There's 2 kinds of these things. The the only one that was available when Dad died and we needed it for Mom was one where you push the button. And so you wear it around your neck, and you're supposed to wear it 24 hours a day. So if you need help, it's tied into your telephone, your landline, which people of that generation, they all had landlines. And yeah, I don't know what the younger generation is going to do when they need a lifeline. It doesn't tie in with your cell phone. But